Alright, so I'm first going to start with the palpitations of the bone. So I'm first starting with the tibial tubercle, which is going to be here because the tibial is on the medial side. And then the Gerdy's tubercle is right across from it on the lateral side. And then we have our pes anserine. So our pes anserine is going to be over here on the lateral side around the Gerdy's tubercle. It's the muscle going down and connects there. So the fibular head, lateral side, is going to go all the way up and connect into here. The common peroneal nerve is the peroneal nerve that goes over the Gerdy's tubercle, and it runs from the patella down to your ankle. So our medial and lateral condyles, when you bend the knee, are going to be medial and lateral. And the epicondyles are the two bones on the back that connect with it. The adductor tubercle is going to be in the back on the medial side by the epicondyle. The base of the patella is right here, is going to be the top of the patella, and the apex is going to be the patella at the bottom where it's going into a point. And then the popliteal fossa is the area behind the kneecap. So I'm now doing the ligaments of the knee. So you have the MCL over here, which is going to prevent valgus. And then you have the LCL over here, which is going to prevent external tibial rotation. So now I am going to palpitate the soft tissue, muscles, and tendons. The first one is the rectus femoris, which is going to be the big middle muscle of your thigh. So it's going to be right here. And then you have your vastus medialis, which is going to be all the way down here on your lateral side, medial side, because it's on the medialis. So it's going to be down here, vastus medialis. And then vastus lateralis is going to be the opposite side on the rectus femoris. And then vastus intermedius is going to be the one right here next to the rectus femoris. Your patellar tendon is going to be, this patellar tendon is coming down from the patella, connecting your tibia to your patella. And then your semimembranosus and your semitendinosus. Tendinosus is going to be here on your lateral side, and your semimembranosus is on the back. Your bicep femoris is also going to be on the back of your thigh, and your IT band is running from your knee up to your hip. So next is the active and passive range of motion. So we're going to be starting with flexion. So I'm just going to grab down here and assist you into going into flexion. And then we're going to go back into extension. Okay. And usually I would have a goniometer to measure the angle and how far range motion wise she can go, but obviously I don't have that at home. So then you're going to go ahead and do it on your own. You're going to go as far as flexion on your own and extension on your own. Okay.
Yeah.
So we're now going to move on to special tests. So the first one we're going to do is an anterior drawer test, which is going to test for a rupture or if the ACL is intact. So I'm going to ask you to go into flexion. I'm just going to put my hands here, and I'm just going to pull on your leg. And if it shifts or if there's any pain, you would have a ruptured ACL. Next is going to be the Lachman's test. So a positive Lachman's test, you'll have pain and you'll have a lot of gapping and shifting for your ACL. So for a Lachman's test, I'm going to keep you in the same position. My left hand is going to go above the knee. My right hand is going to go below the knee. And I'm just going to pull upwards. And she doesn't have any gapping. Do you have any pain?
No.
Okay, so she has a intact ACL. Next is the lever test. So the lever test, I'm going to put you into flexion. And I'm going to internally rotate while pushing you into flexion. Do you have any pain?
No.
Okay. Next is going to be the posterior drawer test. This is just another way to test for an ACL. So you're going to go back into flexion, and instead of pulling forward, I'm going to push back and see if there's any gapping. So, say here. Okay. Okay, so there's no gapping, doesn't seem to have a torn ACL, proven with the other two tests. Next, I'm going to do the pivot shift test. So I'm going to have you put your leg straight out, and my hand is going to go under here, and I'm just going to push down. And her leg goes up, that means her ACL is still intact. So next I'm going to do the posterior sag test. So this one's just testing for the PCL and integrity. So it's just going to go up into flexion, and I'm going to hold the bottom of your foot, and you're just looking for any displacement of the tibial tuberosity, which you don't have. So next is going to be the valgus stress test, which is going to be testing for a torn or ruptured MCL. So I'm just going to lift and go externally and put valgus pressure on the lateral side of the knee, and she doesn't have any pain, she doesn't have any gapping, so she has a good MCL. Next is going to be the varus test. So I'm going to do the same thing, except I'm going to internally rotate her leg and put valgus stress on the internal part of her knee, and there's no cracking, no gapping, anything, so she's all right. And then we have our McMurray's test. So our McMurray's test is going to be, you're going to externally and internally rotate the knee while putting force down. Do you have any pain? Do you have any clicking?
No.
Okay. So the next test I'm going to do is the Thesely test, which is actually the patient doing the test themselves, so I'll just explain it. They're going to be standing up. You don't have to actually do it. I'll just explain. They're going to stand up and they're going to bend their knee at a 5 degree, and if there's any clicking or anything like that, that means you have a positive Thesely's test. So next is going to be the Ober's test, so I'm just going to ask you to lay on your side. Doesn't matter which way.
All right.
So for this one, you're just going to raise it up, and you're just going to put some force down onto her lateral side of the knee, and she doesn't have any pain, there's no gapping, there's no clicking, so she doesn't have a positive test for that. And for the next one, she's going to be doing almost the same thing, but this one's going to be testing for the IT band. So for this one, you're going to be raising it up a little higher, and you're just going to be moving her up and down and see if she has any pain in that IT band. Do you have any pain in the IT band?
Nope.
All right, so she's good on that one. So the next one we're going to be doing is the Fairbanks apprehension test, which is just testing the displacement of the patella. So I'm just going to have you go back into a supine position and put one knee into flexion. So I'm just going to be testing to see if your patella will displace, and it's not, so your patella seems to be good. And the final test, I'm going to have you lay on your stomach, and you're just going to put this left leg up in the air.
Okay.
So for this test, this is going to be the Apley's test. This is just a compression test to see if anything's loose or gapping or anything like that. So I will just put force down on her knee and just internally and externally rotate. And if I hear any clicking or if she has any pain, that means she has a positive test.